Spring is here, and so is the March issue of ASJ. My selections include 4 international original articles with commentaries from the breast surgery, cosmetic medicine, body contouring, and research sections. Don't miss the 3 international translated abstracts in this month's issue in French, Portuguese, and Spanish. Next month, 3 abstracts in Turkish, Korean, and Chinese. I also invite you to listen to this month's podcast series from the breast surgery section, 6-year evaluation of Motiva round and ergonomic smooth silk surface silicone breast implants, a 2-center, 2-surgeon outcome analysis of 1,053 primary and secondary breast augmentations and augmentation mastopexy. And of course, as always, I encourage you to listen to the monthly ASJ Open podcast. From the breast surgery section, I have selected this international original article from Australia by Dr. Elnaz Masoumi and colleagues, who looked at the efficacy of a breast implant assessment clinic to gather information on adverse events and patient-reported outcomes after breast implant surgery. The authors found that having a well-trained and certified surgeon performing cosmetic augmentation significantly lowers the risk of implant malposition and deformity. The commentary by Dr. Jim Grotting applauds this initiative and calls for prospective protocols to help tackle such important questions. From the body contouring section, the question is raised: do compression garments prevent sub-Q edema after abdominoplasty, and does wearing a compression garment after abdominoplasty result in less subcutaneous edema post-op? The international paper from Brazil by Dr. Bettina Zimmerman and co-authors tries to answer those questions and concludes that while wearing garments could theoretically increase incidence of VTE, the authors found a decreased risk of edema. A commentary by Dr. Alexandra Keene and colleagues recommends further review of complications such as seroma in a larger sample size and in patients undergoing combination procedures to put these findings into further perspective. Another international contribution from the cosmetic medicine section, an original article from Germany by Dr. Mariana Calomeni and colleagues, looked at the injection of soft tissue filler with a cannula and ultrasound guidance for precise application within the intended tissue plane. They report that the results were improved by injecting less product into deeper tissue layers. In his commentary, Dr. Mark Magnuson expresses surprise that the physiochemical properties of the filler were modified in a way that could no longer be detected with ultrasound, indicating it may be due to a visualization of integration. What is shockwave therapy? Does it have any role in plastic surgery? In this international original article from the UK, Dr. Catherine Wigley and colleagues discuss electric shockwave therapy, ESWT, and how it affects patient outcomes. They report that ESWT has a good safety profile, no adverse events, and they call for more research within plastic surgery. The commentary by Dr. Alain Michon indicates agreement with the authors about the paucity of research and published articles in the literature on the use of ESWT as a monotherapy treatment in plastic surgery. Further evidence-based recommendations are needed, but the article shows promise for the future and its use in clinical settings. We're happy to bring you a publication on shockwave therapy. That's it for March. Next month is April. It's our special issue for the Aesthetic Society meeting in April in Miami, and I look forward to seeing you there.